Hospices crumbling as charities fear the budget impact on end-of-life care. I'm going to read into this exclusive from iNews, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an exclusive from iNews with the headline that hospices are crumbling as charities fear the budget impact on end-of-life care. Dozens of MPs signed an open letter to Care Minister Stephen Kinnock calling for emergency funding to cope with the unsustainable cost next year. Guys, while you're here, make sure you hit the like button and share it across social media so others are notified of this video. But Regan, the budget was a good thing, wasn't it? In some parts, yes, but in also many parts, it was not very good. The increase to the national insurance employers will have a detrimental effect on the people who work within hospices. Now, they are in this piece. They are going to be talking about the cutbacks that they were going to be already making, and while the increase in national insurance will no doubt be of a help to them, it's already a struggle for them. And they are in desperate need of some sort of cash injection to keep them going. No one near the end of life should have any kind of suffering whatsoever. Now, I understand the consensus that people may make this argument of we don't have money, that we can't just put, money doesn't grow on trees and whatnot, which is not true. There's always funding there. There's always money there if the government needs it. And it's just a case of political will to do so. And we want to make sure that those who come to near the end of their life, we want them to have as peaceful as a passing as they possibly can. I remember my nan had a peaceful passing when she was going near to the end of her time, and I was not there on her last day, but I know that those closest to her got to see her and got to say goodbye to her, and it was perfect. Some people don't have that. Some people don't have the end of life care that they deserve, but all people should be given an opportunity to have that care when they're near the end, regardless of who they are. And we need to make sure that they are given that ending, that the end of their life care that they deserve. And that's really important. Unfortunately, it's not just coming down to money. It's also carrying on to recruitment and retention as well within the hospice industry. So let's read a bit more into this, you guys. So hospice around the country will start reducing services and could be forced to close due to significant financial crisis, in which charity leaders say will worsen due to changes announced in the budget. 1 in 5 of the UK's 200 hospices have already made service cuts in recent months or are planning to. According to Hospice UK, even before the sector is hit by the imminent rise in national insurance contribution and the minimum wage as set out by the Chancellor Rachel Reeves in October, Hospices sounded the alarm on the eve of the budget, with Chief Executive telling the Eye that the plans created uncertainty over finances. Employers will now pay a national insurance rate of 15%, while the minimum wage will rise from £11.44 to £12.21. Hospices UK described the changes due to come into force next April as potentially disastrous for a sector already facing a £60 million financial shortfall. Several charities have joined forces calling for an exemption to the increases. Some 60 cross-party MPs have signed an open letter to the Care Minister Stephen Kinnock to be published on Monday, so it'll probably be out by the time you see it, calling on the government to provide emergency funding for the charitable hospice sector and to commit to long-term reforms for its funding model. This is to prevent further cuts to frontline hospice service and staff, the letter seen by the Eye states. The MPs said the funding hospice receives from Integrated Care Bonds (ICBs) is inconsistent and often does not reflect the cost of the service hospice provide on behalf of the NHS. And they write that the hospice sector unsustainable funding model has not withstood the cost of living crisis, and hospices are reducing services and making frontline staff redundant as a result. Hospices can be a key partner in supporting the government's shift into more care into the community. Hospice services keep people out of hospital who do not need to be there and can ensure that they can die in a place of choice with the care they need. We call on you to provide short-term funding to prevent more cuts in the sector and commit to working with Hospice UK on a long-term funding solution for the hospice that is fit for the future. The latest figures show that hospices provided palatable and end-of-life care to 300,000 people in 2022 and 2023. Most hospices are charitable, independent organisations who receive some statutory funding for providing NHS service. On average, one of their incomes come from a government, with remaining 2/3 raised by fundraising, which has been hit by the cost of living crisis. A Liverpool baby hospice was saved last week after the city helped raise funds for a new home. Zoe's Place, a charity that cares for children with life-limiting conditions from birth to the age of 5, needed to raise £5 million in 5 weeks to find new premises, while an extra £1.4 million was needed to help the hospice stay open in the meantime. This is crazy. This is crazy. The charities are having to pick up the slack for governments. It should not be the case that charities should have to pick up for them. We have government for a reason. They are supposed to be there for us. That is the government's job. And they're not there for these hospice. It's unacceptable. Charities should not be doing the work that the state should be doing. Zoe's Place is one of 3 baby hospices in the UK which support children with life-limiting conditions, in some cases offering end-of-life care. The Liverpool service helps about 50 families each year. However, many others remain under threat due to significant financial pressure, with 1 in 5 already having made services cuts or planning to. 6 hospices have already announced service reductions and redundancies this year, Hospice UK said. In September, Lichfield-based St Giles Hospice announced that it was proposing to cut around 15% of its workforce as it faced unsustainable rise in cost. The charity said a real terms reduction in NHS income, large increases in utility and costs, and reduced voluntary income were to blame. That followed Hospice Care announcing it would replace its care at home service with a new rapid response care service to ensure its long-term future, having already been cut the number of beds in its ward in Exeter. According to Hospice Care, the latest figures show that it received just 15% of its funding from the Devon ICB compared to the national average of 27%. 15%. Tony Collins, Chief Executive of St Michael's Hospice, North Yorkshire-based Heret Hospice Home Care, and Just a B Bereavement Support had told the Eye the budget has worsened our future's outlook at this stage. Most NHS ICBs and around the country increased their funding by a very, very small percentage, so the financial gap has widened. The costs are going to be between 7 to 10%, but the average funding increase was around 1 to 3%. As only around 25% of hospice care is funded, there is already a significant burden on raising the money elsewhere. The fundraising has become harder as we are still dealing with a cost of living crisis, so we're being pinched from many sides. The fact that there are a lot of service closures and bed closures isn't surprising. Unless there are signs of improvement, I would expect to see a lot more of that. The volunteer sector within the NHS, a smaller part of the NHS itself, is absolutely crumbling. You have this bizarre situation where the state funding of the hospice sector, for the very first time, less than we made through selling clothes in charity shops. The premise that the Conservatives were doing over the last 14 years is to throw ownership and responsibility of failures in areas to charities to look after, rather than them paying out at the expense of taxpayers to doing so. It is not the work of charities that should be doing these things. The government is supposed to be taking ownership and responsibility for it, but instead what they're doing is offloading it onto charities. But guess what? They have to find money from somewhere. So when it comes to end-of-life care for people that you love, you won't get it. And the people that you love won't get it because the charities cannot carry this burden. There is not enough people to donate yet to these charities. There are so many charities out there. There's only so much money people can give and support. There really is only so much. We have to be realistic here. Should be the state paying for this. Hospice will start putting together their budgets for 2025-2026 for the next few months. And if there is no solution on the horizon, more hospices will be forced to close, Mr. Collins said. The national insurance and minimum wage rises will add around 400,000 to the cost of running our 2 hospice next year. I can categorically state now, I can't take that. So either we need to find a way to cover that, or I need to decrease costs. That's a dire state to be in. The extra £22 billion announced for the NHS budget last month was incredibly welcome, but Mr Collins said there was no detail on how much that would filter down to hospice or care homes. Officials said further details on allocation of funding for next year would be set out in due course. Katie Reddy, Head of Policy of Public Affairs at Hospice UK, said even before the budget announcement, the UK hospice sector was facing a £60 million funding gap, with fair staff wages as its largest expense. The national insurance rise will only deepen the crisis, adding hundreds of thousands of pounds in additional costs for the average hospice. Without urgent financial support, the long-term funding reform, more hospice will be forced to cut essential services. The Health Secretary has recognised that hospice funding is imbalanced and has outlined plans to expand the community end-of-life care. However, without a firm commitment to sustainable funding, these vital services are at serious risk. It's all well and good saying that he cares about it. It's the details. We don't know the details. Officials said that while the majority of palpable and end-of-life care is provided by NHS staff and services, they recognise the vital part of the voluntary sector organisations, including hospice, providing support to people at the end of life and their families. A government spokesperson has stated that we want everyone to have access to high-quality end-of-life care, and we are aware of the financial pressures facing the hospice sector and of the huge generosity of the British public, whose donations provide a significant proportion of hospice funding. And it shouldn't be that way. It should not be that way. We are determined to shift more healthcare into the community and ensure patients and their families receive high-quality personal care in the most appropriate setting, and hospice will have a big role to play in that shift. Into the community. The I reported last month that charities were asking for an exemption to the national insurance increase. Reports on Sunday suggest the government was looking at helping hospice by providing more funding through the NHS, according to The Guardian. So they're not going to exempt them. There's going to be a lot of things that aren't going to... Yeah, there's a lot of people who are going to be asking for exemptions from the national insurance employer rise. But it doesn't look like they're going to be exempting them from the sounds of that. But it's possible it may change. Possible, but I'm not holding my breath on that, guys. But it is possible that some of the funding that West Streeting received might go to the hospice section. It's entirely possible that might help with this section. But we honestly don't know. That's the problem. We don't know as of right now. But we know that the hospice is in a critical situation. End-of-life care, like I said at the start, is really, really important. We need to do everything we can to help it. And it does shame me that we rely, once again, on charities to help out here. Again, it just should not be happening. I'd like to think that West Streeting will get on top of it, but I just think at the moment, I'm not holding my breath on this guy. I really don't trust him. I think he's the biggest snake out of all of them in Labour, if I'm honest. But maybe I'll be wrong in a year's time. But let's hope that they get the funding they need so that they don't go under. Let's hope so. So what do you guys think? What do you guys make of the situation that hospice are going through, in particular here in England? Do you think that some of the funding that the NHS receive will go towards them? Do you think West Streeting is just talking out of his backside when he says he cares about the hospice? Let me know your thoughts and more on all of this down in the comments section below. If you found this video informative, please hit the like button. We greatly appreciate it. Share this across social media so others are notified this video. If you haven't subscribed already, please consider subscribing because it really does help support the channel. If you want to go one step further, financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or you can join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.